Let's go through some home care if your little one is having an ear infection. One of the main issues with an ear infection is that fluid from the ear is not draining properly. So I'm going to show you 3 different techniques. You can do this with your child sitting upright, or you can do it when they're laying down. I like to do this right before bedtime. I think it's a great way to wind down, but you're welcome to do it 2 or 3 times throughout the day, provided that your child will allow you to do it. You can set yourself up with a little bit of coconut oil if you'd like. It's not necessary, but it can help you glide a little bit easier. A little bit of coconut oil, and if you want to add like a drop of an essential oil, maybe like a lavender, it can make this even more relaxing. So the first area we're going to contact is right behind the ear, in between the ear and the jaw. So you're going to find the area behind the ear where you feel the bone. You're going to feel something hard right behind the earlobe, right here. You're going to follow that down. And if you're following the contour of the ear, eventually you'll feel the back of the jaw here. You're going to settle into that nook right underneath that bone, right in between where you start to feel the back of the jaw. There's going to be a little ridge, sort of a little nook. You're just going to be lightly traveling in that nook. You do not have to use a lot of pressure. This can be a really sensitive area for the kid. So I'm going to find that area on my little baby here, right behind the ear, right in between where I start to feel the back of the jaw, gently coming through there. So I like to use my fingertips. It just helps to moderate the pressure. So we're going to come right in here. If you're doing this on a little kid and you want to use another finger, a middle finger, index finger to use even less pressure, you can. Right through here, downward strokes towards the back of the jaw. The second area you're going to find is right in front of the ear hole. Ear hole is here. You're going to come right in front. You're going to think about drawing out from the ear hole and then down along the jaw. You can do this in one sweeping motion, like so. I'm going to find the ear hole on my little baby here, right in front, and I'm going to go straight down. I can go forward, and then down, forward, down, drawing the fluid away from that area where the jaw meets the ear hole. The third and last area we're going to do is the ear itself. We're going to help to traction out, drawing little circles to open up that ear tube, the eustachian tube. Again, help with fluid drainage. So what you're going to do for this one, you're going to actually have your finger inside of the child's ear. So this, you are going to use your thumbs. You want to make sure you're keeping a super light contact, and you're not going to contact the earlobe. You're going to actually have your finger supporting the base of the ear. So you're actually up in there. This can be a lot of pressure for a child with an ear that's infected and inflamed. So even if you're just gently tugging down to create a little bit of space, you can have the child open and close their mouth, like so. That's all that's necessary. If you're able to, you can start to work some gentle circles. You'll settle into place. Gentle circles forward, gentle circles back. Allow the child to breathe, and it's always an option if your child is old enough to follow instruction to open and close the mouth. So what that would look like with the child if they were seated, I'd have my fingers in the little ears here. I'm either just gently tractioning down or I'm drawing little circles. All of these can be done with the child laying down. I would find the first point behind the ear along the jaw, like so. The second point would be here, coming out from the ear hole. The third point would be inside of the ear itself.